Okay, let's discuss about autocoids. Okay, so autocoids are self-acting local hormones. It is autocrine or paracrine in nature. So, what are the autocoids? Basically, you see histamine, serotonin. It's known as 5-hydroxytryptamine. It is found from the decarboxylation of the tryptophan. It is an amino acid tryptophan. Okay. Now, in lipid category, we have uh, icosanocyde, prostaglandins, leukotrienes, thromboxane A2, lipoxins. In the peptides, we have bradykinin, endothelin, angiotensin. All right. So histamine is from histidine. Okay. Now histidine decarboxylase से histamine बनता है, ठीक है, by decarboxylation of histidine. Okay. Now effect on the receptor, that is the GPCRs. So we have H1, H2, H3 and H4. We have GQ, GS, GI. Okay. H4 we have just WBC and chemotaxis. Now H1 is present in the CNS, also in the allergic response. This is a triple response, ठीक है, इंटरडर्मल इंजेक्शन से हम लोग देखते हैं H1 का response. H2 is present in the stomach, increases the HCl. H3 is the presynaptic autoreceptor, decreases the H1 and H2. It is the H3 is the presynaptic autoreceptor. Okay, so it is G inhibitory, ठीक है, जो भी इसका फंक्शन होगा H1 H2 का उसका कम करेगा. तो वी हैव H3 इन्वर्स एगोनिस्ट नोन एज पिलोलिसेंट, टिप्रोलिसेंट, ठीक है. तो दीज आर इन्वर्स एगोनिस्ट. वन ऑफ द एग्जांपल्स ऑफ इन्वर्स एगोनिस्ट इज टिप्रोलिसेंट एंड पिलोलिसेंट. It will increase the H1 activity and it will be used in the narcolepsy. The drug of choice is modafinil, but tiprolisant is a newer drug. It is H3 inverse agonist. It will act on the daytime sleepiness in the patients, right? H2 receptor blocker, you decrease the HCl production. Cimetidine, nizatidine, ranitidine and famotidine. Okay. H1 partial agonist is the beta histine. Beta histine वर्टिन के नाम से आता है. Beta histine is used in Meniere's disease, increase in fluid in the ear or vertigo. Okay, BP, PV. Okay. Now H1 blockers, we have antihistamines. Antihistamines, there is first generation and second generation. In the first generation, it can cross the blood-brain barrier, causing the sedation. It has anticholinergic property, so the side effect is memory loss and atopic line, dry eye or dry mouth. The second generation has no blood-brain barrier cross, right? Anticholinergic property is not seen except the cetirizine causing the sedation, right? Anti-vertigo or antiemetic, in the motion sickness we are using seasickness, morning sickness. They are as it used the H1s, right? So the pilots, drivers and machinery workers will be given. H1 will be H1 is not used. The H2, the second generation will be used. Okay, the first generation is not used. Okay, so it is contraindicated to give in the daytime. Only first generation given in the daytime is the chlorpheniramine. Chlorpheniramine present in the Sinarest or Febrex Plus. So chlorpheniramine is there phenylephrine के साथ, है ना. So that is the least sedative first generation. But the first generation highly sedative is the promethazine. Promethazine is the maximum sedation, maximum anticholinergic property, maximum local anesthetic property also. Okay, diphenhydramine, hydroxylizine, ठीक है, that will break into the cetirizine. So hydroxyzine is the prodrug of cetirizine. It is the longest acting. Doxylamine, with act on the vitamin B6, is the drug of choice for morning sickness in the pregnancy. Drug of choice for morning sickness in the pregnancy. ठीक है. There is dothepin. It's a tricyclic antidepressant. Okay. Now modulatory sedative is the cinnarizine, also block the calcium channel on the vestibular neurons. Cyclizine and meclizine are for the motion sickness and seasickness. Okay, cyproheptadine is like anti-serotonin, anticholinergic, antihistaminic. So these are all the a single drug which is acting on the all the three receptors: serotonin, cholinergic system, as well as histaminic system. So it's used in migraine, and it is a very important drug, cyproheptadine. Okay, least sedative, chlorpheniramine, I've said, is the first generation least sedative. Clemastine, tiprolidine, these are the least sedative H1 blockers. Now second generation antihistaminics का बात किया जाए तो it's used in anti-allergic. ठीक है, so बात किया जाए there are few drugs like terfenadine और estimizole. ठीक है, तो उससे क्या होता है कि these are metabolized by CYP3A4. ठीक है, but due to ketoconazole and erythromycin acting together on the CYP3A4, these are inhibitors, so it will increase estimazole and terfenadine. Now these are banned because of QT prolongation or torsades de pointes. So these are the CAT drugs: cisapride, estimazole and terfenadine. CAT drugs. These CAT drugs will increase the QT prolongation in the ECG and causing the arrhythmia, torsades de pointes. The active compound is the fexofenadine, that is now used in Allegra, and it increases the QT prolongation but very less. Okay, and it is also non-sedative, so used in place of levocetirizine. Like levocetirizine is less sedative than cetirizine. Now levocetirizine is sedative, but fexofenadine is non-sedative. QT prolongation is present in fexofenadine, which is not present in levocetirizine. Okay, loratadine is desloratadine is the active part. It is the most potent. Loratadine, cetirizine is the most effective anti-allergic. The side effect is the sedative in nature. Levocetirizine half dose, less sedative. Okay, and rupatadine is also used. Now topical antihistaminics जो are used like in allergic rhinitis or conjunctivitis. Azilastine, it has a maximum topical activity. Levocarbastine, olapatadine and ketotifen are mast cell stabilizer also. Levocarbastine and alcaftadine, these are the new drugs which we can say in the second generation antihistaminics. So these are the antihistaminics.